How was your childhood? What was it like growing up in Baltimore, Northeast?
So I grew up with my mom. She was a single parent, my younger brother. Before my mom was able to have her own house, we were living with my grandmother. So I've been raised by my mom's mom and my mom my entire life. So very inspirational women, the backbone, which is why I think I'm the person that I am today.
Yeah. So what schools did you go to? What was it like going to school? Did you go to public schools, charter school, private
So
schools?
I went to private school
Okay.
for most of my elementary, middle school. I went to Parkville High School for high, and Morgan for undergrad. I got my bachelor's in psychology, and then I got my master's in human service administration.
What made you want to study psychology?
That was so long ago. I think I wanted to be a psychologist at that time, just because I wanted to help people. I just had this vision of people sitting down talking to me and me fixing everyone's problems. So that was initially why I took up psychology.
Is that something that you did naturally with your family? Were you like the psychologist of the family? Or?
I think so, and with my friends.
Okay.
I believe so. So always that person that wants to help everyone. Yeah. So yeah.
So fast forward to, you said you got your master's?
Yes, in human service.
Where'd you get your master's from?
University of Baltimore.
Oh, nice. Okay, so I live a couple blocks away from UB.
Okay.
And human resources?
Human service.
Human service.
It's program management,
Okay.
grant writing, basically how to develop a program from start to finish.
Okay, and what made you want to get that master's?
So it was a toss-up between that or social work. But I realized that my passion was more along program design and implementing programs because I have two nonprofits. So before I started at UB, I had a nonprofit for pregnant and parenting teens. So I thought that it would be better to get a degree where I'm developing that program, redesigning it, just ways to improve what I already have versus social work.
I'm waiting to see if I have to sneeze. Okay. It's like, I hate that feeling, like you're about to sneeze.
Yes.
I was sneezing and it's funny, I made a mistake, and I was texting you last night because I wasn't feeling well at all, and I was hoping I wasn't getting like the flu or something crazy.
Oh, goodness.
But I texted, because I didn't save you on my phone yet, so I texted a million numbers in my phone that I saved, so I texted the wrong person. But anyway, it worked out. I'm glad we did it.
Okay. You could have inboxed me on Instagram.
I know. I didn't. I wasn't thinking. I was like, because you did text back. I was like, baby, she has the kids. They're sleeping or she's tired or something.
No, I would have responded.
All good. Okay, so yeah, we're talking about you getting your master's. So I know you had mentioned to me, or I had looked up, that you had started an organization.
Yes.
What was the first organization that you started?
So Dream Girls Mentoring Program was the first organization that I started, and that was to help pregnant and parenting teens in Baltimore City. It was in 2008 that I started it. At that time, we had a very, very high teen birth rate. And my reasoning for starting it was because I had helped a lot of my friends in high school who had, been pregnant at that time. And one of my friends, she had my goddaughter at a very young age. And so I was able to help her navigate the system to be able to get more resources and support for her and her child. So that was kind of my reasoning behind starting that program.
So for people who don't know, tell us a little bit about, I guess, the teen pregnancy, I don't want to say problem, maybe challenge that is within specifically the African American community, and why is that a challenge? I might know, but...
Yeah, so the biggest challenge is that they're not able to finish high school. And that after high school, they see nothing after that. So with Dream Girls, the purpose was for them to see life beyond high school, to let them know that you can go off to college and get that degree, even if you have a child. You can get that career that you want. And it was just basically to pushing them towards greatness and not letting them settle for less. So... a GED is okay, but you can still get your high school diploma. You can still go to school. You can still do what you want to do.
What are some of the barriers that are facing girls and women who get pregnant at a young age? Like maybe financial barriers. What are some of the things that they now have to worry about because they're bringing a child into this world?
So at 15 years old, you can't get any resources on your own. you have to go through your parent. And so if your parent makes too much money, you're not getting any help from Department of Social Services.
Wow.
So at 15, how much can you make at McDonald's or Chick-fil-A? $7, $8, $9 at the most maybe. You can't afford daycare with that. So then daycare becomes an issue, because how can I afford daycare and go to school? So that's why schools like the Paquin were very, very important until it shut down.
What school?
Paquin.
Paquin, can you tell people about this?
So Paquin was a program on Sinclair Lane. It's now the Lily Mae Carroll Jackson Charter School. But it was a school where the girls could bring their babies. And if they were pregnant, they had nurses on staff, so they weren't missing prenatal care.
Wow. So what happened?
So
do you know what happened to that school or that program? Or
I don't.
Funding, I'm guessing?
I'm assuming funding. And then, of course, the teen birth rate did improve in Baltimore City at some point.
Yeah.
It's still an issue, but I know that teens were able to go back to their regular schools when they got pregnant.
Got it.
So when the school first originated, teens had to go to that school. Now they can go back to their school. So there was no really much of a need anymore.
Is the pregnancy rate disproportionate? So, mind you, I don't know how much you know about the stats behind this, but as people who aren't from Baltimore might not know, especially when I was growing up, Baltimore was kind of split.
Yeah.
So it was like West and East were predominantly African American.
Yes.
And then North and South were predominantly Caucasian.
Yes.
So because of that, I'm curious, were the rates, and for people who don't know more, like North Baltimore in general is historically wealthier, because a lot of the money that was in Baltimore City moved up north,
Right.
Along 83,
Right.
and then out into the county, and you got the Hunt Valley and the Ricerstown, Owens Mills,
Right.
etc. So do you know if the pregnancy rate within poor Caucasian communities is the same, different, greater, less than that of African American communities?
That's a good question. I don't know. I know that it varies between the different areas. But I know that with African American women, it's always significantly high. So their areas are higher.
Yeah, it's so we can get a little bit into the other organization that you started. Can you tell us a little bit about that one?
So Elijah's Hope Foundation was an organization I started back in 2015 after the loss of my son at 15 weeks. And that's an organization that helps women after pregnancy or infant loss. And more so, we're helping women who get pregnant after a loss, because that type of grief is different. So that was started back in 2015.
So this might seem like an obvious question, but for people who don't know, what is infant loss and why does that happen, if you don't mind explaining that?
So infant loss can be due to SIDS, which is sudden infant death syndrome. And it could be preterm birth, or it could be of natural cause or other health-related issues.
What's preterm birth?
So a baby born between 24 weeks and like 36 weeks.
Okay.
So not born full term. So full term, of course, is 40 weeks. So anything less than that is preterm.
Got it.
So what was the other question you asked me?
No, that was it. That was the only question. No. I was just trying to learn more. Okay, so you started.
And SIDS is a sleep related infant death. So babies laying in bed, and it's the ABC rule that the Baltimore City Health Department put into place. So alone, on the back, in the crib, don't smoke. So most families, when you don't have your baby sleeping safely, unfortunately, the end result could be that your baby passes away.
Wow, that's like a whole other thing.
Yeah.
Because one day I'll be a parent. I'm like so nervous about that.
Yeah.
Okay, so you started Elijah's Hope, and that was in hopes to help young teens specifically.
Well, not teens.
Oh, okay.
Any woman who has a loss.
Okay.
Yes.
Is this like a support group, or is it like services provided, or?
So originally it started out to be a support group. Now we're looking to do women who get pregnant after a loss. So you have your loss, you go through your grief, and then you get pregnant. And so there's a lot of grief and PTSD that comes along with, oh my gosh, is this going to happen to me again?
Of course.
So we want to provide that support to those women. I'm also the maternal interviewer for the Fetal Infant Mortality Review Board through the health department. So I do a lot of work with maternal and infant child health.
How big of a factor is sort of home environment, stress levels that contribute to some of these issues? Huge.
So systemic racism has always been a factor with pregnancy and infant loss. Black women are 2 times greater to have a loss than a white woman. A black woman with a college degree, she's more likely to have a loss than a white woman with a high school diploma. And that's because of systemic racism, the environment you live in. When a black woman is going to work, her wheels are constantly turning when she gets home. She can't turn it off because the next day when she goes in, she has to make sure that she's the best that she can be so that she can get that promotion so that she won't get in trouble for doing anything. Whereas a white woman doesn't really have those same problems that we have.
Yeah. And I'm glad that you broke it down because systemic racism can be such a big term for people. And when you break it down into like actual situations, that's really helpful.
Yeah.
Because I do think that, and this is why I asked that question, because in Baltimore, because Baltimore can be such a segregated city in some places, it's so, the problems sadly are put onto one specific demographic, which in our city are African Americans.
Right.
And so people undervalue, or not undervalue, but might not even know the type of pressure that African American woman is under on a daily basis. And I think nowadays it's kind of being talked about a little bit more. I know that because a lot of, as with anything, whenever you have allies or people that become popular celebrities who are talking about the issues, it kind of trickles down and everybody else starts to care about it a little bit, and it kind of gives you a moment to kind of have that conversation and hopefully try to change somebody's mind. But at the end of the day, when you were speaking, I know, for instance, I had a conversation with a friend of mine about who's not from America, and he was asking me about why don't black people go to the doctor, or why don't we X, Y, and Z, or go to services or whatever. And it's difficult to try to explain to somebody that you might not even know why. Like, I didn't know why I didn't go. I just knew that my family didn't go.
Right.
And because my family didn't go, I didn't go. It's a cultural thing, but the reason why it's a cultural thing, if you dig deeper, is because historically, logically speaking, if you know nothing about slavery or whatever, if you just know a little bit, you know that African Americans had no reason to trust any government-sponsored organization. So that's why a lot of like my grandmother was a midwife. A lot of people had those skills to be able to do those services at home, have at-home births, because they didn't trust hospitals.
So I think a lot of times, especially with black women, we're not heard. Our concerns don't matter. I could use myself, for example, when I was going through my loss. I remember calling my doctor on the phone and telling him these symptoms I was having, and him brushing it off as if it was nothing. And so I think that happens a lot with us when we go to the doctors. We're pregnant. We say we're having this type of pain. And instead of the doctors taking that extra step to figure out, okay, what's going on, it's like, oh, you're fine. Or, oh, it's this. But did you check? How do you know that it's this? Our bodies are different everybody's body is different. So you can't just say that, oh, you're having back pain, so it must be this. No, it could be something else. So even, Serena Williams talked about it with her traumatizing birth, how she didn't feel like she was being heard or her concerns were being heard. It just happens.
And it's like if Serena isn't being heard,
exactly.
Then I feel like nobody's being heard.
Exactly.
And it's on the flip side, and I'm not trying to play devil's advocate, but I remember bringing this up, that same conversation, and there is an issue with doctors and the amount of patients that they see.
Yes.
And it's just like any job. It's right. Like it's the same way that people hate the DMV.
Yes.
Right. After so many people that you see,
Yeah.
it just becomes monotonous, and you just stamping the thing, or you're like, yeah, your back hurts. Just take 2 aspirin, or just whatever. And of course, there are some doctors who take that extra step, but on the whole, this is like
it's not enough time.
It's not enough time in the day.
And we talk about that at the Fetal Infant Mortality Review Board meetings, and so we also talked about having someone else with the doctors, because a lot of times when doctors talk to you about what's going on, they're using a larger vocabulary that you may not be able to understand. So it's like, okay, give me the layman terms of what you're saying. And if they don't make sure that you understand what they're saying, you'll leave that doctor's office and have no idea what's going on with you or your pregnancy. So what can we put in place to make sure that these women are understanding what's happening to their bodies? And if you don't have, that extra minute or so because you have a whole waiting room full of patients, how do we put that extra care into place to make sure? Can we put it on the discharge papers? Can you have your nurse practitioner come in after you? Like, what has to happen so that we leave there feeling like I was heard, my questions were answered, and I'm feeling okay about everything? So,
and not to complicate things, but then you have to add insurance on top of.
Don't get me started on
top
insurance.
of all that. Like, if we don't have to go deep into it, but as you're talking, I myself, recently am currently paying for my own health insurance out of pocket.
It's expensive, isn't it?
It's ridiculous. Yeah. And I have very basic, about to die insurance, and it's crazy. And I did that just because I take a specific medication, and my medication is $400 a month if I don't have insurance. So then I pay for insurance, which is like $300 a month. So I'm saving $100, but then I pay an extra $50 for the medications. So when it all shakes out, I might be paying $500 a month for insurance plus my medication instead of maybe just the $400. But then there's a whole other services that I get discounts on or whatever because I'm paying an insurance company. So I'm sure that plays a role.
Insurance plays a role into some of the women that I've helped throughout my journey with pregnancy and infant loss always have told me that they felt they were treated differently because they were on medical assistance. I can personally speak that I was on medical assistance at the time that I lost my baby, and I do think that that played a factor into, me calling, talking about my concerns, the treatment that I got afterwards. I wholeheartedly believe that your insurance can play a factor into it.
Yeah, and I think, sadly, being on any sort of government assistance, medical assistance, Section 8, et cetera, is one of those things that if you've never been on it, you don't really understand how people treat you or how landlords treat you or how jobs treat you. If you're on it, obviously, you said you were. I remember my mom was on medical assistance, and we were on Section 8 when I was younger. And I remember us going around to see different houses, and once people found out, oh, we're on Section 8, oh yeah, we don't want you living around here. Or if we did move into a neighborhood, like a nicer neighborhood, but people knew that we couldn't afford the neighborhood because of our car or because those little things, then people kind of look at you sideways and you're treated like you don't belong in your own city.
Right.
That you were born and raised where they might not even be from the city.
Right.
So I think, like you're saying, all those factors, this goes back to the stress and that pressure. My mom was a single mom as well, raised me and my sister. And so I remember watching her go through a lot.
Yeah.
Just like
they make a lot of sacrifices. I mean, I'm a single mom now, so I've made tons of sacrifices just to make sure that my kids have everything that they need.
So what made you, taking all that experience, and you specifically said African American women aren't heard, but you're running for city council. So that means that you want to be heard. So
exactly.
So tell me a little bit about the decision that went into you running for city council.
I think all of the community work that I've done has kind of set the foundation for me running for office. I am a former Baltimore City Youth Commissioner, so that was kind of like my first start into government, working with some of the elected officials on just like community work. And I really, really, truly enjoy making people happy. Doing things that I know will improve the lives of others. I really, really, truly enjoy that.
And what are you looking to get done as a council person? Like what are some of the goals in your mind, even if it's small goals specifically for your district? What are some of the things that you see in your district that you want to change?
So I have a platform. It's to create a clear path for District 2. And PATH stands for Public Safety, Academics, targeting small businesses and healthy families. So I'm in the northeast area. Bel Air Road is like our main corridor. So when you're driving up Bel Air Road, you see we're saturated with liquor stores, beauty supply stores, corner stores, car dealerships. And those are great.
Bunch of businesses.
Yeah, those are great. But, right on the other side is Harford Road. And it has nice coffee shops, the bookstores. It's like, I want that for my community as well. I want the residents in my community to be able to walk out on Bel Air Road and be proud to live right off of Bel Air Road. So I want to bring more sustainable businesses into the area. I want those businesses that are currently there to invest back into the community to our youth.
That's
You want more programs and things for the youth. We always talk about we don't have any money. There's no money in the budget, but there's hundreds of businesses out here where the residents frequent almost on a daily basis. They need to be investing back into the community that they serve.
Yeah, it's interesting because so I went to school for business.
Okay.
And I'm an entrepreneur. And from the perspective of an entrepreneur, it's really tough starting a business in Baltimore.
Yes.
Right? As you know,
Yes.
exactly. It's like you're in a rock and a hard place because if you're a business owner and you happen to have a business in a community that is challenging or that may not have a higher household income, medium income, then you have all these factors, quote unquote, working against you. And so then on top of that, now you're asked to give some extra money to the community. So I'm curious about what incentives are you thinking about, or are the people in your district thinking about for those businesses that would make sense for them?
So money is great too, but the experience is better.
Okay.
Give these children, mentor them, get them off of the streets, give them the jobs, give them the internships, teach them the trade. So when I say invest, I mean really wholeheartedly, like invest in our community. I think that we need to bring the small businesses together for town hall meetings. They may not be able to vote for the elected officials because they may not live in the area, but they have a business here.
Yeah.
And it's about relationships at the end of the day. And we need to leverage the relationships that are in this community.
Yeah.
So that's two things that I want to do. We haven't had a library in 18 years. I'm really big on this, advocating for this library, yes. It used to be at Bel Air Road in Frankfurt. It's a Head Start now. And so when I did my research, the former council person before Council President Scott, he made mention that it wasn't really in the budget, and so it was a toss-up between either having more police officers with guns or libraries with books. So ultimately, that was one of the libraries that they had to shut down. And there's only 2 districts in Baltimore City without a library, and we are one of them. Every district in Baltimore City needs to have a library. The 9th district.
Where's that at?
That's Councilman John Bullock. So.
You know what area? No.
Take that out of here.
Yeah. No, that's fine. It's fine. I can edit that out. But yeah, so you guys don't have a lot. So I wanted to talk to you a little bit about, you said it was a toss-up between libraries and cops with guns. That's always interesting to me because when you have a conversation with somebody in real life, they never say we need more cops. Not never. but rarely people that I talk to, let me say that, when we talk about the issues in Baltimore, rarely do people say more cops are needed. But there seems to be, from the city level, the idea that cops are going to solve the issue. Somehow, and when you look on TV and you look on WBAL and you see certain city officials, whoever that may be, and I'm not talking about current city officials only,
Right.
this is since the beginning of my time.
Right.
And from what I heard since the beginning of my mom's time and grandmother's time being here, of cops are the answer. And we see this around the country. But people don't believe, a lot of people I think are increasingly starting to believe that the current system of policing does not work. Now, I spoke with Senator Mary Washington a couple days ago, and we talked about the importance of community policing.
Yes.
And people kind of hear that term thrown around and think it's probably kind of corny, but I think it's the best. I think it's the only solution from the perspective of the Baltimore City Police Department and the perspective of the people, to have cops that actually are invested in the community, have real relationships with people. It's similar, not the same, but it's similar to how they had guidance counselors in schools that had relationships with with students. So when they got in trouble,
you knew who they were.
Yeah, you can kind of be like, okay, this is whoever, this is Keyshawn, this is whoever this person is. I know that he had a rough day yesterday. This happened, and so he's just acting out. He's just upset, or she's just whatever. Right. But there's just this lack. There's like a wall, and it's us versus them. And that's all over the city for as long as I can remember. There have been a few cops here and there that I've experienced that were amazing, but the system in general, that culture, we feel as though it's just like they're in their car outside of you, and they're looking at you while you're walking down the street.
Right. Instead of getting out the car, having a conversation with you.
Yeah.
You know, letting them know that you care. You're not just sitting behind that steering wheel in the car.
Yeah, and it seems to be, I personally believe that it's like you want to have this fear. Yeah. Because if you're a cop, I'm imagining, I'm not a cop, but if I'm imagining myself to be a cop, a police officer, then you're constantly in these situations to where you have to assert your dominance over 1, 2, 3, 4, 5 people to get whatever it is that you want to get done. Whatever your training has told you, you have to do this, you have to control the situation, you have to blah, blah, blah. So in order to maintain that level of hype, you now have to create this wall to where people don't, it's like teachers who kind of become too friendly with the students, then you think people ain't gonna respect you. Right. Which to me, it's like, I understand that, but at the same time, I feel like there's just this wall. And so I'm curious about what what are some of your thoughts about initiatives or the way that you can have an effect on on the district's relationship with police officers? So I totally agree with the community policing. There used to be programs like Officer Friendly that would go into the schools. So with my two children, they're 3 and 4, and I had to have a conversation with them because boy, girl, boy, two girls. 2 girls. Yes. Wow. And so they saw the police and they were like, "Are we going to jail?" They're 3 and 4 and automatically assume that when they see a cop, you're going to jail. So having that initiative where the police is going into the schools, greeting the children, I think is very important, because at 3 and 4 years old, they should not think that a police officer is just going to automatically put them in jail. Yeah. So I think bringing initiatives like that back into the schools, and also having them attend certain events in the area, just so they can get to meet the kids. Because it's beyond just policing. You need to be a community present, and has a community presence as well. And it needs to be, of course, there's going to have to be, with everything you're saying, the buy-in from the community. People in the community are going to have to put aside some of their thoughts about cops, because, yes, we live in Baltimore, so we already know everybody feels a certain way about most cops because of what we saw growing up, what we know to be true. But at the same time, it's like, we could talk about the problems all day, but if we're not willing to put to put the past behind us, so to speak. There's no way to move forward. And I think that's something that's happened in the city where you have these initiatives or things that might happen or whatever, but people on both sides or on every side are still kind of holding on to, well, this happened, blah, 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 or this. And of course, I do that naturally. Everybody does that. But it's like if we really want to move forward in the city together, we're going to have to start thinking about how we can let go of some of that trauma, some of that hurt, or some of those experiences that we saw when we were younger, and try to believe that it is possible to have a good interaction with the police officer.
Yeah, I agree.
You know, any more things that you are focusing on?
So, of course, education. Advocating for more early childhood education programs in that area.
Absolutely.
Universal pre-K. So no matter a person's socioeconomic status, at 4 years old, you should be able to go to pre-K.
Is that not a thing?
So you can go to pre-K, but it's like a tier system. So based off of the income, you will have first priority if you are low income. So, like, my 4-year-old cannot go to Baltimore City Head Start. I mean, not Head Start. Head Start too, but pre-K as well, because I make too much money. So she wouldn't qualify for the program. Yeah, so universal pre-K is everybody gets to go, no matter how much the parent makes or not, which needs to be implemented immediately. So I will advocate for that. Early childhood, I work at the Judy Center, so I'm a big advocate for early childhood education, more programs for our seniors. Yeah. And, of course, the maternal infant child health piece. We have a very high infant mortality rate in Northeast Baltimore, particularly in the Bel Air, Addison, Frankfurt community. So I would definitely do my part to ensure that women have more services and resources provided to them in that community.
That's amazing. That's a lot.
That is a lot.
But I believe that, I believe if elected, you 100% could do that.
I sure will.
Well, I want to thank you for coming. This was an amazing conversation.
Thank you.
Are there any social media, website, follows?
Yes. So Instagram and Facebook at Elect Tamira Dunn. Okay. My website is www.tamiraforsecond.com. Okay. We're always looking for volunteers. Okay. So if you're interested in volunteering, you can go on the website and fill out the form. Donations as well are helpful. So you can go to the website and hit the donate button as well.
Does someone have to live in your district in order to run? I mean, not run, but in order to help you, in order to volunteer?
No. Okay. You can live wherever you want to donate or volunteer.
Great. Yep. Okay. Well, thank you so much. This is great.
Thank you.
Really appreciate it.
Thank you.
That was good.